We are meeting today to discuss Alaska being the very first state in the entire Union to take action on solving the vitamin D deficiency epidemic. I'm Carol Baggerly with Grassroots Health, and I have the pleasure of being here with Representative Paul Seaton of the state of Alaska, and we're going to talk with him about what led him to initiate this life-saving action. I'm so glad to meet with you.
Well, thank you, Carol.
Thank you.
Nice to meet you.
Please tell us a little bit about what got you going on this. This is very exciting.
Well, I live literally at the end of the road of the United States road system in Homer, Alaska, and we don't get cable TV. So we have one of the satellite TV services, and one of the channels on there is University of California Television. And so I watch a number of research programs and those kind of things. And one day last fall I was watching, and here was one of this program on vitamin D deficiencies, and I think it was Dr. Garland. And I'm watching that and saying, this can't be true. Why don't we know about this?
Common response.
Yes, and so, one program then led to another, and there was a whole series on the conference that was held at UC San Diego, medical school down there, and all of these researchers were presenting evidence that my scientific background was recognizing as being valid, and so that's what stimulated me to get into the vitamin D issue and start researching it. Went to your website at grassrootshealth.org and was able to access many more research papers, and I decided that Alaska, the far north, probably the least vitamin D in the nation, needed to recognize that preventative health is something that we want to stimulate.
In addition to Representative Seaton today, we have Dr. Robert Haney, one of the world's best-known vitamin D researchers, and I would really like to ask Dr. Haney what he thinks the impact of this resolution is going to be on the world vitamin D community. Dr. Haney.
I think we're dealing with an issue that is fundamentally public health oriented, and that means we need to be able to take governmental action of some sort or another.
Yes.
I mean, examples would include such things as the iodination of salt, which is necessary to prevent goiter, and which has been adopted by most of the industrialized nations around the world. For example, that's a governmental action as contrasted with an individual person's decision about things. So the beauty of Alaska taking this step is one that's preeminently logical. Being far enough north, as of course Alaska is, there's no way to deceive yourself that you're going to get adequate vitamin D from the sun. Now, if you live in the southern portion, even of, say, Florida, then you have the comfort of thinking, well, I'm probably getting enough sun. But of course, if you don't go outdoors or you cover up all the time, then you're not getting it there either. But there's an excuse for people in the lower 49 for putting this off. But the Alaskans have, through Representative Seaton, have bitten that bullet and are starting the process. And so I think it's a giant first step that ought to be copied by many other legislatures. I hope will be.
I think one of the exciting things as well is the fact that it is so far north, and the impact will also show up in the public health measures very clearly. Whereas if you started in a possibly more replete population, it might not show up as fast.
Vitamin D is unique in that it has both individual impact. Some people will really notice the difference, but it has clear public health impact, and that's where the ability to count things at a population level will clearly show that this is going to be doing something for us.
I want to come back, though, to the diseases in Alaska. What are some of the key things that you already know are really, really going to be impacted by vitamin D supplementation?
Well, up here we have a really big problem with colorectal cancer. We have breast cancer, are two of our biggest problems. And when I was seeing the data, looking at population studies and which group do you want to be in? Do you want to be in the group with the lowest vitamin D, which most people in Alaska have, or do you want to be in a sufficient population and the relative risk of getting either one of those cancers would be less than half if you're in the upper group? I would like to help move the population of Alaska to the upper blood levels of vitamin D instead of being in the lower end.
And you can do it. I'm totally confident. I'm ready. You've actually introduced a resolution. Tell us a little bit about the resolution you've introduced.
Well, the resolution we introduced was to try to move to a preventative health model instead of a treatment of disease model. And what we're doing...
This is a first all by itself, even though it's not vitamin D. I mean, even for a state to take action to say it's time to talk about prevention.
And we do have a number of small initiatives, but
Yes.
they're isolated. We
Right.
talk about prevention in one place or another,
Right.
but
Right.
the focus has always been on treatment of disease.
Right.
When somebody gets sick, or on health care as far as insurance goes, how do we insure people to get treatment instead of what can we do to keep them from getting sick in the first place. So I'm really excited. We've had in the past a huge problem with periodontal disease in the native
All right.
villages. I mean, we have some villages where 80% of the children by the time they're 5 have had full mouth reconstruction.
Oh my.
Yes, I mean it's.
At 5.
Yes, and so I was very delighted to see the relationship between vitamin D and periodontal disease. So diabetes is a big problem for us, growing problem for us, just like it is for everywhere in the nation.
Right.
But all those, so I might just backtrack, and in the resolution, what we did is we put a lot of whereases, each one talking about a specific disease, and then citing the research paper, the population study that backs that up. And so that's where we're coming from. We're happy to have this whole Health and Social Services hearing today on vitamin D, and we welcome you folks here to give us more information.
Oh, that's great. Within the resolution, one of the things I noted, though, that's to me also, you're paving the way for other people to take action. And I've already shared the resolution that you have introduced with several other people. And they will be contacting you because they want to use it as a model for what they're doing. So it's just like, thank you.
Oh.
Representative Seaton, one of the things that you've done that I think is truly an ace, I mean, you've done so many things. Representative Seaton has passed out to every member of the legislature a health voucher. And this health voucher says, start yourself on the Prevention of Disease Healthcare Initiative. And it comments a little bit about the various blood levels of vitamin D that people probably have. And then he says, unless you've been to Hawaii this week, use a tanning bed regularly, or eat a fillet of wild salmon several times a day, you're probably like most Alaskans, insufficient or deficient in vitamin D. And then he goes on to enable people, this is a voucher, mind you, that they get to take to his office to get a free bottle of vitamin D. I love it. Please tell me, have you had lots of people respond?
We have. So far, we've had about a third of the House of Representatives come in and redeem their voucher. So we're thrilled. We're hoping that we keep ourselves healthier
Oh,
and
that is so
start
great.
on the mission.
That is so great. It's so great to introduce a fun thing to do. Where would you like this to go now? Where do you kind of anticipate this going right this minute?
Well, we appreciate you folks coming to Alaska to help us, get into some of the research and the background. And then I think we have a Saturday presentation to the broader community and health community as well. And then what I hope we will do is pass this through the House of Representatives and the Senate, and the governor, we're requesting that he start us down a prevention model.
Fantastic.
And so if we get to that point, then we will be recognizing and starting to test and identify what our levels are in various parts of Alaska and how we get ourselves up to sufficient levels.
This is monumental. Thank you so much for doing this. It's great.
Well, it's for our benefit,
Of
and
course,
I'm really
of
happy
course.
that we had access to the information, because
Yes.
it's something that we haven't heard. You generally in the media, what you hear is you hear something positive, and then there's always another side,
Right.
and they're always balanced as if they're the same. A concern is the same as actual research,
Right.
and it's it's too bad because the research should, and those results should actually weigh much more heavily than just somebody's expressing a concern. But
Right.
often the media doesn't
Right.
do that. So
Right.
this is going to be a good forum to present the research, a broad amount of research from around the world. And so that's what we're looking forward to.
Thank you. All right.